as you can see, this is the key data sets for the nutrition cluster. The tool is very simple, and the main purpose of this tool is actually for the information management officers as well for the cluster coordinators to be aware what is the main information that they should have in their respective clusters in order to analyze situation and to make the informed decision. The tool, it's not all the possible data sets that you might have in the nutrition cluster. However, we tried to put here the main key data sets which you should be aware of and you should collect from different sources. As this is the first version, we would be very happy to hear your feedback if you think that we didn't include something here, and we can add it anytime to these key data sets. So what I'm going to do now is to quickly go through the categories and present this information. So the first one is the food security. The data sets are first integrated food security phase classification, which you are aware of. It's an analysis which is done by the food security cluster, and now it's also done together with the nutrition cluster, which presents the information on the food security and classification of different areas on how it's insecure. The second food security dataset is the intervention they are conducting, which is basically the 4W, which you should be able to get from the food security and agriculture cluster IMO. I guess I don't need to discuss there why each of those datasets is important, but if you have any questions later on importance of a dataset, please let me know, I will answer. The next type of the data sets is geographical data, which you should have mainly for mapping, but also for the geographic analysis. Locations where assessment planned and where assessments have taken place. It's not only for the nutrition assessments, but also for the intercluster assessments, and you get this information from your partners or from the OCHA. The next is the administrative level boundaries for the mapping. Usually now all the such datasets are stored in the Common Operational Datasets database on the Humanitarian Response Info website. However, if you cannot find it, feel free to contact OCHA in your country for these datasets. Just to emphasize that importance of using the same data sets but by all the humanitarian actors and all the clusters. Therefore, it's important that you all make sure that you are using the data sets from OCHA, and this is the main purpose of creating the Common Operational Datasets database. The next geodata is the prioritized areas for the assistance from the governments and then from the NGOs and UN. Again, this is to be able to do analysis on where you need to intervene and where some of the assistance has already been covered. So this is the main geodatabase sets. And then we go to the health cluster or sector. It's again functional and non-functional local health government units, because all nutrition interventions are often linked to the health intervention, and it's important to ensure complementarity. Again, functional and damaged health centers and hospitals, all health centers and hospitals locations, again 4W interventions, and location of disease outbreaks, because it has effect on the malnutrition rates, and it's important to ensure it while you're doing your nutrition analysis. Again, nutrition, we only put few data sets. However, we understand that there are much more. We just put the main data sets. So first one is the coverage of micronutrient interventions. global and severe acute malnutrition rates per different admin levels, infant and young child feeding practices, again per different admin levels. All these three pieces of information you would normally get from the latest surveys. So it's important that you have this in your cluster database, and at the next webinar we are going to talk about survey database and how you organize the information you have. But this is for you just to be aware that you should have this information in the cluster. Then again, 4W, your 4W for the nutrition cluster, and seasonal calendar. We put it into nutrition, but we could also put it under the food security. Yes, actually you would get it from the food security cluster normally. And then on the fuse.net website you would normally have seasonal calendars for the different countries. Then people data sets, again majority of them you would get from the OCHA or from the government, or depending on the emergency sometimes it's available from UNHCR or IOM. You have to see in your particular situation. So again, it's affected people, location, the latest census data, death rate or population growth rate, because you would need to project your census data from when it was done to the current year. However, often it's already done by OCHA, so you can just contact OCHA for the latest population numbers per admin level 2 or 3 or 4 or whatever they have. Then location of evacuation centers and camps, number of IDPs and refugees in evacuation centers and camps, spontaneous settlements, and total numbers of IDP refugees per admin level. All this information, as I said, you would get from the OCHA, IOM, UNHCR or CCCM cluster or government, and you would need it for yourself in order to plan your response and to calculate caseload. The WASH cluster is the last data sets. It includes access to improved sanitation and improved water source, which you would get usually from the government or from the WASH cluster, and this is also assessment-based information. Cholera outbreaks, diarrhea, acute totally diarrhea levels, again usually from the WASH cluster. Sometimes you can get it also from the health cluster or the government. Then flooded areas linked to population data, because again this is a high risk areas for the waterborne diseases, and would influence would impact where the camps are location. And then again interventions for W interventions for the WASH cluster, which you would get from them. So this we were considering as the main data sets which should be in every cluster. However, as I said again, we would like to hear your feedback, or you can write email to me anytime if you think we missed one of the important interventions. Now, do you have at first any questions? And second, do you have this information in your clusters, and what are the challenges of procuring this information? And if you think if there is any other information that that we should add to these data sets.
Does a global nutrition cluster come with the data flow diagrams or something that can help us to design a regional database to understand the workflow of this data and how we can update it with time, like this?
Okay, so this is the key data sets which you should have in the nutrition cluster. It's not necessarily that you should have them in one database with all the information. You can just have them as a separate data sets, because they are actually, the purpose of them can be very different. For example, like admin level boundaries, you don't need to store them somewhere in a, I don't know, in a separate database, because you would need it just for the mapping. We do not have as such information flow diagram for the datasets. We are planning to develop, but it's not part of the IM toolkit because it's more coordination related, but we are planning to develop for the cluster coordinators the diagram for the analysis of the situation, like situation analysis for nutrition and emergency, which would include majority of these data sets and how you would analyze them in order to come up with a holistic approach to the nutrition in emergency. We hope it will be developed this year. However, again, as I emphasize, this is how to utilize these sets, not how to store them. Many of the key data sets related to the assessment data, and we do have survey database developed, and we are going to present it at the next webinar, which would help you to extract information from the datasets to analysis. However, just for storage, you can store them like in a normal way in a separate folders.
Okay, thank you.